No downtime cosmetic treatments are more popular than ever. So how do you get the most out of a cosmetic consultation? To give us the latest on this trend, we have with us today a nationally renowned, award-winning, double board-certified facial plastic and reconstructive surgeon, Dr. Rich Castellano, CEO and medical director at ImageLift, to tell us more. Dr. Castellano, always nice to see you.
Thank you for having us, Cindy.
Let's talk about your book, The Smile Prescription, a bestseller. You can get it where and what's in this book?
It's a wonderful book. It's on Amazon.com. You can download it on Audible. And we're using this to teach bedside manner to doctors and to help patients get a good perspective on how to do a cosmetic treatment. Because none of our treatments look as good as Mother Nature's free facelift.
Right.
We're going to do a treatment for Euphemia today, and you can see she's so beautiful.
She is gorgeous.
And we look our best. Euphemia, just try and relax and no smile at all. See, if we all just flat, we don't look so good, but we put the smile back on our face.
It's hard for Euphemia not to smile.
I know, she's such a good smiler. And so that's how we set the stage in a good consultation, because if you set the wrong expectation, people will choose treatments that go too far, and you must look natural when you do a cosmetic treatment.
It's so nice to hear you say that. Okay, what are we doing today on Euphemia?
So today for Euphemia, we're going to be doing some of the Bellafill, and we're also running our contest. The lucky winner will also have a treatment similar to what Euphemia is doing. It's a cheek injection. Now, we'll show some of Euphemia's pictures from when she was younger, and she was beautiful then, she's beautiful now.
Yes.
You see the volume in our face. So when we look at our photos from when we're in our 20s or 30s, you see how the volume in our face changes. And we look at Euphemia today, she looks so elegant, but as we age, we lose bone.
Definitely.
So today we're gonna do just a little bit of fill right through this area, and I already did some of the numbing because we get a little bit of the hollows under the eyes, so we're just gonna do a little fill through these areas. So I've already done some numbing medicine. Now when I do the Bellafill, we've done some cleanse on the skin. I'm gonna do just a little bit extra cleanse because I do a little insertion point where we do the filler, and then I take this little tiny entry point, just a little poke in the skin. Euphemia, did you feel a little bit of a pinch right there?
Just a tiny pinch.
Bit. So
not much.
Tiny pinch, not too bad. And that's the insertion point. Then what I do is I take the filler. So this is Bellafill. This is the longest lasting filler.
Longest lasting filler. Okay,
yes,
I'm all ears.
It is not absorbed by the body. And then we just thread it through that little area. And as I do this little twist and shiver technique, we train doctors on how to do this technique. You'll feel a little pinch there, Euphemia. Do you feel a little pinch, big pinch?
I feel nothing.
And so what I do is I just fill that area where we get the dark and hollows under the eyes. We're being a little bit more preventative for Euphemia because she already looks amazing.
Yes,
but if we're lucky, aging keeps coming for us, so we want to be ahead of the game rather than behind. So right now I'm injecting just like 1/10 of a cc, and she'll feel a little bit of a pinch in through those areas. So you can see, not an emergency procedure. It's something that is very casual, and she's of course smiling a little bit. And you will feel some pinching, but as we say, we try and make it easier than getting a tattoo, or easier than the dentist office, I should say.
Now, when you say this is long-lasting, how long-lasting are we talking?
So the Bellafill is 80% collagen and then 20% PMMA. So the collagen gets absorbed by our body and replaced by our body. The PMMA is non-absorbable, so it stays with you. And that's what patients want today. They want longer lasting fillers. So we put just a little bit of fill in there that was almost 0.2 cc's. I'll put a little bit on this side here, but we just wanted to demonstrate that's how simple fillers are.
Okay.
Make a big smile, Euphemia. And so you've got to keep it looking natural. She'll have a little bit of swelling, which is to be expected, but she'll pass the grocery store test today.
Oh, yes, she will. Nobody will know that she's had some filler put in. You feel good?
I feel fantastic.
Wonderful. You look great. Dr. Castellano and his team at ImageLift are having a contest where you can win a seat right here on Daytime to get a filler yourself. Head to facebook.com/ImageLift to find out how to enter. You can also register for ImageLift's seminar on June 2nd. Just call 813-463-9245 for more information. Thank you again.
Thank you so much, Cindy and Euphemia and Charlene, our amazing team. They take such great care of me and our patients.
I love it.
Thank you.
All right, we'll be right back, so don't go away.